Ladies and gentlemen, welcome back to the Health and Wellness Pod. I am Dr. Lewis. Now, I have taken keen in female genital mutilation, that is also known as FGM, and I realize that this is a topic that is often a taboo to talk about, and when you try to raise awareness, you get to offend some people. However, I still find it important to raise awareness about female genital mutilation, and to me it is not a taboo to talk about it. However, it is a taboo to undertake it, okay, because again it's the law again. So today in this video we're going to discuss female genital mutilation, and you're going to know or understand why it is practiced, what can be done to prevent these practices, and again what are the harmful effects of female genital mutilation. So therefore join me in this video, and again share this video as much as you can so that we can create awareness to those people in the societies that still practice FGM, because they have failed to work out of traditional methods or ways of trying to tame, in quotes, women's sexuality. So by definition, and I'll read this to you, FGM is basically a procedure where a girl or a woman's external genitalia is partially or completely removed. Now I'll repeat, is partially or completely removed. This includes the clitoris, the labia, and sometimes the vaginal opening. Now, there are several issues that cause or lead to people practicing this, and we'll talk about them as the video goes by. However, I want you to know that most communities perform this without using even anesthesia, local anesthetic agents like lidocaine, so they don't use it. And again, they don't sterilize the equipment or instruments that are used in performing these practices, and those two are enough to lead us to the harmful effects of female genital mutilation. And these are basically excessive bleeding, infections as a result of those unsterilized instruments and objects, and then again these people can go into coma and death because of extra bleeding, okay, and then shock. So FGM is dangerous and is harmful to women. We are actually affecting their psychological well-being and the physical well-being. So the ability of these women to enjoy sex when they're married will be altered, even though we were thinking that we are taming their sexual desires so that they can stick into marriage, or we can prevent premarital affairs. We will end up messing these women completely, and their sexual abilities and desire will definitely disappear because of the psychological trauma that they go through. So it's only fair that we raise awareness about FGM, and FGM and circumcision are not the same. For male, circumcision is not the same to FGM, because for circumcision it's a rite of passage, and I think this is also considered as a rite of passage to some communities, and that is bringing a lot of issues, because once the old people have this in their minds, it becomes so hard to change it, because they are passing it from generation to generation, and we have to involve these old people in the process of just trying to prevent this, because we cannot do it by just pushing them into it. Remember, it is deep into the cultural roots, and therefore it's hard to just change it overnight. It has to take time for this to happen, and therefore we are determined, and we hope that through raising such awareness, through educating healthcare providers, because I also realized that most healthcare providers are also involved in this, and some people will run and hide and go take one of the medical practitioners to just go and help them to chop off those organs from their children. And remember, this is harmful, and these are very illegal processes, and therefore there are legal frameworks that have been put aside to just help curb it, because it is dangerous and harmful to our health. So therefore we are here to stand with women. If at all you've ever had an FGM, this information comes to you at a later stage, but again, it is never too late, because we want you to also not to do it to your children, because it harms our generations. So why is FGM practiced? And that is the reason why we are here. This is basically cultural, religious, and even social norms. So there are people who consider it a culture that our women have to go through, our girls have to go through this mutilation before they get enrolled into womanhood, and before they even think about getting married. Also, there are religious practices that involve chopping off of the clitoris, or maybe just a slight cut of the clitoris, and this is proving very dangerous and harmful to our women, and therefore we need to move on from those religious practices that totally encourage female genital mutilation of any kind. Then again, social norms. So this is basically self-explanatory, and some communities basically have some cultural demands that sees a rite of passage for women, again girls, into womanhood, and also they tend to believe that if you consider this mutilation, then you will be a good woman in your marriage. Also, you can be considered as not ready for marriage, and remember, the ultimate goal for women is just marriage and raising and giving birth and raising children. So they think, or they've been made to believe, that if you've not been mutilated, then you have not undergone the rite of passage, and therefore you're still a girl, you're not a woman, you cannot be considered ready for marriage. So this is so disturbing. Okay. Then some believe that it is necessary for to control a woman's urge, sexual urge, and therefore this will prevent, when you chop off their clitoris, it will lower their urge to have sex, and therefore premarital and extramarital affairs will definitely disappear. So these women will not cheat, and the younger women will not be involved in irresponsible sex before marriage. And again, this is proving the reverse, because most women who have even been mutilated, some of them end up being worse than it was expected or than it was designed to. And again, some of them end up being worse in terms of sexual relationship with their husbands, and therefore it's not making sense, because if at all you're trying to tame sexual desires for this woman not to be involved in pre or extramarital affairs with other men, and then the same women failed in having the desire to have a man who happens to be their husband, then it basically means there's something that has to be talked about. That's the reason why we've taken kin in this video. So basically, those are just basically the reasons why this is practiced. So it is so communal, it's religious, it is social, and it's even weird that most women who have not undergone these processes or these practices feel so ashamed of themselves, thinking just because they have not been circumcised or been not mutilated, they are lagging behind, because other women who have been initiated already start laughing at them or start mocking them, that if you're not circumcised, then you don't qualify to be part of our generation. And this is making them even demand for it. So some women demand for these mutilations, and you can imagine how that sounds. You trying to challenge and trying to help them get out of it, and yet most of them have been indoctrinated to believe that this is the rite of passage, and therefore you cannot go against it. And that's the reason why we want to involve our old men and our societies and our communities, the older people in the communities, to help us fight this type of issues, because we cannot do it on our own. It is hard, but we also training our healthcare providers to at least know how to identify these cases and basically how to report them, and the legal procedures, legal frameworks and channels that are there should be provided to the ground, so that when this is reported, the culprits are taken, justice takes its course. Okay, so basically those are just reasons why we do it and why it is practiced, and therefore this will lead us to our next point, which is basically the harmful effects of FGM. Most of you have known the effects of FGM. So for those who practice it, they think it is a beneficial issue, because it leads you to, it grows you from girl to womanhood. However, the harmful effects outweigh the benefits at all. And again, I don't think there's any benefit that comes in as a result of FGM. There are so many harmful effects, both long-term and short-term effects, and we will discuss them here. And one of the basically the short-term effects of this and even also the long-term is basically the physical and psychological trauma that these women go through. Some of them don't say or don't talk about it, but they die silently. Okay, so the short-term effects basically will include the pain. So when these women undergo this cut, it is so painful, because remember, the clitoris has a lot of nerve endings, and the more the nerve endings on an organ, the higher sensitivity it is. So the clitoris has a high number of nerve endings, and therefore it is highly sensitive. Also remember, it's the organ that is involved in arousal and basically orgasms in women. So if you chop off this, it is very sensitive, so it is very painful, and therefore one of the side effects of this, or one of the effects that come as a result of FGM, is basically severe pain, and this is trauma, both physical and psychological. Again, we have bleeding, and most women have been reported to have anemia. So most women will be rushed to hospital late, trying to manage these conditions, because remember, before they take these women to the hospital, they have to give them herbs. Then as time goes, when it gets worse is when they come to hospital to try and report these cases and try to salvage these women. Now, by the time you're coming to hospital to treat a patient who has been chopped off a clitoris, it can be very late. These women will be having sepsis, infections, okay, and all this, and they have been bleeding all through. As you try to manage them, you can't stop the bleeding using herbs. So it becomes so hard, and they are so much in pain, and most of them end up in anemia. So some of them die, of course, and a good number die because of anemia and even shock because of loss of blood and fluids in their system. Then another one is basically infection. That is self-explanatory. Those instruments that are used to perform these functions. One of the issues is that you can lead to a spread of HIV, because these women, the same instruments or tools that are used on one woman will be used on another. There is no sterilization of these instruments. There is no appropriate procedures. There is no use of anesthetic agents, and there is no use of antiseptics, and also prevention of infection. So these women, as much as they'll come with the bleeding and all this infection, they will also come with anemia and even dying because of shock. So those are just short term. Basically, it's severe pain, bleeding, anemia, infections, and death. What about the long term? Because again, these are divided into the short term and the long term. The long term are much traumatic, because these women experience so much pain, and this can lead to chronic inflammation. Okay, so they can't even have adequate sex or appropriate and satisfactory sex because of inflammation. Then again, stillbirths. So stillbirths basically means most of them come when they come to give birth, the children, their fetuses are already dead. So the growing babies just die, and this is associated to FGM. Again, maternal deaths, that is obvious, and then sexual dysfunction and psychological trauma. So those are just basically the long-term effects of FGM. Now, across the world, all these practices are being done, and millions of women are suffering from these conditions. And this just basically mutilation. So any type of mutilation, be it the vaginal opening, be it the clitoral cut, be it the labia cut, all these are practices that have been going around the world, and most communities practice it, and that's why millions of women are suffering from it. However, we have never raised a voice, okay, and we tend to raise voices through NGOs. But remember, on my side, I believe NGOs are not here to help you. NGOs are basically here to help themselves, and therefore somebody is benefiting from this, and it's our duty or our role to just get involved in this fully. I know most of the women in these cultures that practice this, like Maasais, like the Kushites, most women have resisted these practices. However, the old people, the traditional men and women in this society is the one, and it's even worse that women are the one who take their children to do these practices, okay, to perform these practices, and they are the same people who perform them. So it's weird that it has been instigated by women, yet it's so unright. Women know already the effects of this, but they're the same people who still take their children to do this. And I've worked in environments where these practices are done, and it's even hard because most women will even take their children secretly from their husbands to just go and get the cut. And then these women sit in their houses for more than 2 weeks, crying out of pain and bleeding. And then the sepsis comes in, and these women are starting to have all these infections. And some of them die, and it's unfortunate that once they die, it's a God's plan. It is sad that is what is totally said, that is God's plan that these women die, and therefore it's taken lightly. So this has to be taken so serious, and I'm glad that there are legal frameworks that are busy on the ground, and there are channels that you can use to report these cases, and they'll be punishable by the law. Okay, so basically, how do we prevent this? Because we cannot just talk about it, we cannot be emotional about it and not offer solutions. We need solutions. And what are the solutions that are supposed to be taken to curb this issue of FGM? Number one is basically FGM violates human rights and is against the law. So you should know that if you're found carrying out FGM, you will be jailed, and is punishable by law. Okay, so on that note, we should raise awareness about this by talking to the older people. We should involve them. We should not fight them. We should involve them in these discussions. We should also involve them in creating these legal frameworks, and also promote education in them to just make sure that they get the harmful effects of FGM vis-a-vis the benefits that they think it offers. Okay, and therefore, so we should raise the debate and the awareness about the harmful effects of FGM, and also incorporate education practices that help us to educate these women about these harmful effects. And these women, once they get it, that will be hard for you to perform it on them. They will start resisting it. So we want to ensure that we change their mindsets, because this comes from the mind. So we have to change their mindsets and then start educating them about the benefits of not undertaking the cut. Then working with communities to change the cultural attitudes, which means basically we involve these old people, the traditional people, and try to change these norms around FGM. Then again, the legal frameworks, I already told you that there are legal frameworks and there are channels that you can report these issues. And then train healthcare providers to basically help you to identify and report these cases. So this is a point that has become difficult, because you train these healthcare providers, but they're the ones who still go behind your backs and perform these procedures on these women. So it is getting so out of hand that it's hard to handle it, because you train somebody to identify these cases, then the same people will charge these patients because of their greed. They will charge these patients to perform these functions on them, or these cuts, and they're paid wholesomely, so they are even known. And you will hear these women coming to look for one specific nurse or a clinician to just talk to them. Then once you hear that, you realize there's a problem. So it's hard to train all healthcare providers who have a strong mindset about this, and therefore I urge all healthcare providers to at least step up on this one. Okay, so basically that's just it about the female genital mutilation. So in conclusion, FGM is a harmful practice. The benefits are very minimal, if any, but the harmful effects of it are so many, and they outweigh those benefits that you think. So it's a harmful process, and it's violating human rights, and it's against the law. So please resist from it, and then help us help you, women, prevent your daughters from getting the cut. Okay, so thank you for watching this, and I hope that you found this video helpful and very informative. So keep the fight.